The burden of asthma in the United States definitely falls disproportionately on communities of color, specifically African Americans, the Latinx community, and indigenous populations. When compared to white Americans, Black Americans are 1.5 times more likely to have asthma, 5 times more likely to visit the ER due to asthma, and 3 times more likely to die from asthma. Black women actually have the highest rates of death from asthma. When compared to white Americans, Puerto Ricans have the highest rates of asthma prevalence compared to actually any other racial or ethnic group in the United States. And indigenous adults are 2 times more likely to experience daily asthma symptoms and are far more likely to have asthma symptoms that wake them up at night when compared to their white counterparts. These disparities have persisted despite significant advances in the management of severe asthma from a medication and biologic standpoint. And what we know is that structural racism in society has resulted in lower economic opportunity, higher rates of medical comorbidities, decreased access to high quality preventative health care, and increased exposure to environmental pollution in Black and Brown communities. Mistrust of the healthcare system also compounds the problem. Interestingly, genetic factors and individual behaviors contribute significantly less to asthma disparities than structural and social determinants. This means that we have opportunities as a society to implement changes that can benefit large populations in the long term, even if we can't do anything about the genetic determinants of health.